The human body, it has an extraordinary ability to heal itself. Be it a cut, a break, or an infection, its defense mechanisms are quick to the rescue. But some damage is just too much to be reversed. That's where the rejuvenating powers of stem cells step in. Today, Indian clinicians are using them to cure corneal blindness. But how can a permanent loss of vision be reversed by stem cells? That's a question of science. The statistics are staggering. Nearly 16 to 18 million Indians are sightless, making India's blind population the largest in the world. More staggering is the number of those that lack access to basic eye care facilities, which means that many who should have sight today live in darkness.
If you tot up all these numbers, it turns out about 75% of this 16-18 million people are needlessly blind. Blindness that is avoidable, that is curable, that is preventable.
This needless blindness reveals the glaring gap between quality eye care and India's poorest communities. Most are unable to access the critical medical care they need. The few who can stream into big city eye hospitals at great personal cost. Many travel enormous distances for a glimmer of hope.
మాది కర్నూలు జిల్లా నంద్యాల దగ్గర టంగుటూరు మాది చిన్న పల్లెటూరు. ఇంటి దగ్గర సిమెంట్ వేస్తున్నారు మేడం. వేస్తుంటే పాప ఇక్కడ ఆడుక దగ్గరికి పోయి సిమెంట్లో పడింది కన్ను. అది నంద్యాల తీసుకుపోతే ఇక్కడ కాదు LV ప్రసాద్ హాస్పిటల్ దగ్గర తీసుకుపోన్నారు.
Young Swati has her whole life in front of her, but she is already facing a daunting challenge. A terrible accident has left her blind in one eye due to a damaged cornea. What is the cornea and what does it do? The cornea is a transparent tissue layer covering the front of the eye. It allows the light to enter and helps focus it onto the optical lens just behind it. The transparent cornea is an extremely delicate tissue. Even the slightest tear or chemical exposure can rob it of its transparency and therefore the ability to see. For countless patients like Swati, loss of sight from corneal damage is considered untreatable. But now scientists are discovering a regenerative solution, and they don't have to look too far.
Surrounding the cornea of the front of the eye is a lovely ring. It's called the limbus. The limbus actually has stem cells. By a stem cell, what you mean is I'll make more of myself. I'll also produce other kinds of cells. This dual ability of self-regeneration and differentiation to other cell types is defined as stemness.
Stemness is a term that describes the remarkable property of stem cells. These are special cells in our body that can transform into any other cell. For example, muscles, nerves, and blood, etc. Cells found inside the eye's limbus have the same property. They are known as limbal epithelial stem cells. What does this mean for damaged corneas? In theory, this means that limbal epithelial stem cells can grow into a fresh and healthy cornea. But how can this theory be transformed into reality? This was the question asked by Dr. Virendra Sangwan of the LV Prasad Eye Institute in Hyderabad.
What I started seeing is a lot of patients for whom we the doctors used to tell there's nothing can be done. And I was very unhappy about this situation. I said there must be something that we should do. So in the process of that doing something, I came across some article which talked about CLET, cultivated limbal epithelial transplant, for similar kind of patient in Italy. I said, but why? This they can do, why should we not?
In the late 90s, no one in India knew the technology to grow healthy corneas from limbal stem cells. CLET, or cultivated limbal epithelial transplant, had never been performed in any Indian hospital. Determined to change this, Dr. Sangwan engaged the help of researchers at LV Prasad Eye Institute. Together, they came up with an indigenous version of the CLET procedure. So what exactly is the CLET? CLET begins with a simple surgery on a patient with corneal damage. First, limbal tissue is removed from the patient's healthy eye. The tissue is extremely rich in limbal epithelial stem cells. These cells are like seeds, which, if nurtured properly, will grow into a brand new corneal tissue. And so, they are transferred to the lab. Here they are cultured, much like grass grows in a garden. But instead of soil, these stem cells rely on a different medium. This nutrient-rich and biologically safe medium is the amniotic membrane. It is derived from the very beginning of life, when babies are born.
Surfaces the human amniotic membrane, which is what, when we are born, we come out of the bag, and that bag which has the placenta and the amniotic membrane is thrown out. That's very good.
The amniotic membrane acts as a growing medium. It encourages the growth of limbal epithelial stem cells into a cornea. For this, the limbal tissue is first cut into smaller pieces. Then it is sprinkled onto the amniotic membrane. Finally, it's left up to nature to take its course.
Now we have put it into the incubator with media for their growth. So the cells will now come out of the explants and start migrating onto the amniotic membrane, and they'll grow for a period of 2 weeks. So at the end of 2 weeks, all the cells would have migrated onto the membrane, and you get a nice sheet of epithelium on the amniotic membrane, and that will go to the patients for transplantation.
2 weeks later, a new cornea has grown from stem cells. Back in the operation theatre, it's transplanted to replace the damaged cornea. Immediately, the patient regains a transparent cover over their optical lens. Within a few weeks, most patients see a turnaround with clear eyes and vision restored.
2001 April, we did our first cultivated limbal epithelial transplant, and that was probably among the few in the world at that time. And first few patients which I saw the results, I couldn't believe in my eyes. I said, is it possible? I mean, I thought that there is something possible, but this kind of result is just amazing.
The CLET has been a hugely successful stem cell therapy developed entirely in India. Clinical trials have shown it to have a 76% success rate. In fact, the trials themselves have broken records. They've been the largest human trials in stem cell technology anywhere in the world. The CLET procedure gives hope to thousands of Indians who have resigned themselves to corneal blindness. It's a simple procedure that can benefit patients from all walks of life. But how does a cutting-edge stem cell therapy reach the poorest and most remote patients? That's where another kind of innovation comes in. The LV Prasad Eye Institute Pyramid is a novel public health solution to make quality eye care accessible to all. At the top of the pyramid are premier eye care hospitals, which are situated in big cities. This is where India's best doctors surgeons, and researchers are. This center of excellence is networked to tertiary centers. There are 10 such centers dotted across Andhra Pradesh, including one nearly 4 hours away from the state capital of Hyderabad, in a remote village called Tudukurti. The area may be remote, but the Tudukurti Tertiary Center administers world-class eye care. From basic medical consultations to surgical interventions and inpatient services, this is a one-stop shop for nearly 5 lakh people from surrounding villages. It's a full spectrum of eye care services, offered free of cost to those who can't afford it.
We prefer to use the word center because it's more than a hospital. It's not just treatment. We also do prevention programs in the entire community that is covered by this center. And we also provide rehabilitation of incurable blind. So it's a comprehensive eye care.
Besides patients, the pyramid also has a payoff for doctors and optometrists who trade the comforts of the city for this remote posting.
We're getting to do so much of clinical experience by the number of patients that we're helping. Like per month, it's like 700 to 1,000 OPD patients that you're seeing on your own. That confidence has made a big difference over 1 year. Like definitely from what I was 1 year back when I joined and what I am now, it is a big difference.
Centers like Tudukurti cast a wide net across many underserved rural areas. But is there a way to go deeper into the community? The answer, according to the pyramid, is yes. Vision centers are linked to the tertiary centers like Tudukurti and cater to 20 to 25 villages. These are often tiny, 2-room facilities that offer simple solutions, like a pair of glasses that can transform a patient's life. Vision centers are run by vision technicians who are often from within the local community itself.
हायर स्टडी को जाने के लिए मेरे फैमिली बैकग्राउंड सपोर्ट नहीं कर रही थी, सो मैं कुछ करना चाहिए ऐसा. इसमें मैं सर्चिंग में थी. उसमें तुरकुर्ती वालों का वहाँ पे विजन टेक्नीशियन का प्रोग्राम ऐसा चल रहा, उन लोग ही इसे स्पॉन्सर करेंगे और कुछ खर्चा नहीं होगा, ऐसा मुझे मालूम पड़ा.
Vision centers like these have revolutionized eye care at the grassroots level. They're tackling needless blindness at its very source. Whether it's an eye infection, cataract, or refractive problems that need glasses, these are diagnosed and treated within the center itself. Anything more serious, and there's a cyber connection to doctors in Hyderabad. A quick transfer of reports, and a patient sitting in a remote village can get world-class treatment. And so, thanks to the LV Prasad Eye Care Pyramid, patients like young Swati have a fighting chance at regaining sight. She's traveled nearly 200 kilometers to avail of the latest stem cell procedure offered by Dr. Virendra Sangwan and his team. It's a procedure that takes the hugely successful CLET procedure to the next level.
The transition happened primarily because the need for the technique to go to people, and if we continue to doing the cultivated limbal epithelial transplant, there is no way that it can reach to masses, because simply replicating a clean room or a CGMP laboratory is extremely expensive.
The new technique is called simple limbal epithelial transplant, or SLIT. How is it different from the CLET? The CLET requires patients to visit the hospital not once but twice for surgeries. First for the extraction of limbal tissue, and then 2 weeks later for the transplantation. The SLIT reduces the entire process to a single surgery. How did this technology come about? Dr. Sangwan's eureka moment came from a conversation with Dr. Sheila McNeil from the University of Sheffield in the United Kingdom.
she said one word which immediately gave me a hint. Oh my God, this can be done this way also. So she said, we should do a tea bag approach to the stem cell. And immediately I said, oh my God, I should have been doing this for long. I'll do it tomorrow.
So, what does this revolutionary approach entail? Just like a tea bag conveys tea directly to the cup without boiling it separately on a stove, the amniotic membrane conveys limbal stem cells directly to the eye without incubation in the lab. In this way, SLIT combines two procedures into one. First, limbal tissue is removed from the patient's healthy eye. Then, instead of taking it to a lab, it is sliced into smaller fragments right there in the operation theatre. Meanwhile, the damaged eye is covered with the amniotic membrane. Finally, the chopped up limbal tissue is sprinkled directly on it. Over the next 2 weeks, the eye will act like an incubator. The amniotic membrane will dissolve, leaving behind the limbal tissue, which will grow into a healthy cornea. SLIT is a revolutionary procedure that simplifies CLET by cutting lab costs and reducing the patient's hospital stay.
If I tell a patient that we have these two methods, which one you want? Everybody says the one which you can do in one go. I don't want to come second, give and come back again. And now I think in the last year and a half, we have done enough, and the amount of interest the clinician across the world, not only in India, across the world has tremendous.
Since SLIT trials began nearly 2 years ago, Dr. Sangwan and his team have observed an 85 to 90% success rate with patients within 1 year's follow-up. This means that patients like Swati have bright prospects for reversing corneal blindness. Not surprising then that the SLIT is drawing surgeons from across the world to observe it with their own eyes.
Limbal stem cell transplantation is a major focus of my practice back in North America and Canada and Toronto. And I became aware of this new technology and this new technique that Dr. Sangwan has really invented. There's no question that this has international impact. This is a simplified limbal epithelial transplant technique. And as such, I think that countries around the world will be adopting this technology. I know I will be when I go back to Canada.
The SLIT may have global appeal, but its true value for India lies here, far from the big city and big hospitals.
SLIT, I think, is one of those examples which have the potential to have immense value, because the diseases for which we use stem cells today in our country for the surface of the eye are very common in our country, many diseases. And they happen in the villages a lot more.
So what's next for Dr. Sangwan and his team of researchers?
My goal is to make it in a way, document and make videos and teach people so that the technique can be done right way. And also give them a platform where they can innovate further. Because this kind of surgeries, once you have more surgeons doing it, there will be further innovation and refinement, and I may be able to learn from those. And we would like to start doing it throughout the network.
This is an era of translational research. To me, translational research is not limited to translation from bench to bedside. It has to move to the community also. The value of any discovery is only when it has the greatest impact on a community.
Perhaps this is the biggest success of cutting-edge yet simple technologies. By simple innovation, they can break barriers between rich and poor. By creative thinking, they can deliver quality healthcare in both rural and urban communities. And by singular focus, they can bring light to where there was once only darkness. If you'd like to share your feedback on today's program, please send your suggestions and comments to Vigyan Prasar, C24 Qutub Institutional Area, New Delhi 110016, or you can mail us at info@vigyanprasar.gov.in.